Hi, I'm Dr. Sarah Luckakotopoulos. I'm an emergency physician and pediatric emergency physician practicing in Ontario, Canada, and this is my COVID diary. Before we get started, nothing in this podcast constitutes medical advice. My views are mine alone and do not represent the views of my employers or colleagues. By the way, if you missed our earlier episodes, go back and listen to them first. This episode will make a lot more sense if you do. When people hear my last name, they often assume that it's my married name, but it's not. I'm half Greek and half English, and the whole beautiful, confusing, double-barreled thing belongs to me. The last name Luckett comes to me by way of my English mother. My Nana and Granddad, my mother's parents, lived through the Second World War in England. My Nana and Granddad, my mother's parents, lived through the Second World War in England. My granddad was a navigator with the Royal Air Force, responsible for guiding pilots to their target and then safely back home. My Nana was one of the many children and adolescents evacuated from London into the English countryside as an escape from the Blitz, a campaign of targeted bombings by Germany against the United Kingdom. They met during the war, while Granddad was on leave in Norfolk. Much later, they emigrated from England to Canada with their children. When I was little, Nana and I would work on crafts together. She taught me how to hand-dye silk scarves. I would beg Granddad to come down to the basement computer with me. We would type words into the word art program, and he would read them in voices that represented the crazy curves and bulges of the text. It must have been exhausting, but in a family where you don't talk much about feelings, I think that's what love looks like. Granddad died during my first year of residency. Nana died just this past September. I wish I could talk to them now. Like most kids, I was too dumb and self-centered to understand or recognize what was in front of me while it was still there. By the time I was old enough to appreciate Granddad's role in the war, he was too cognitively compromised by dementia to tell me the stories I wanted to hear. Nana never liked to talk about the war. The burden of trauma weighed heavily on her, and maybe that's part of why I didn't talk to her much about her experiences. But I wish I had asked more questions while I had the chance. I wasn't especially close to Nana and Granddad. They didn't know much of my secret hopes and fears, and I didn't know much about theirs. At the start of the Second World War, the British government produced a motivational poster. You probably know the one. White text against a red background, reading, "Keep calm and carry on." It was an exhortation to the British public, a reminder that when we panic, the enemy wins. You might be surprised to know that it wasn't widely distributed at the time, supplanted mostly by other, more straightforward messaging like, "Your courage, your cheerfulness, your resolution will bring us victory." But in 2012, it was unearthed again and became the slogan for a generation that had never experienced social disruption on the scale of the world wars. We trivialized it, printing it on posters and t-shirts topped by a cupcake instead of a Tudor crown, with encouragement to keep calm and eat a cupcake. A few weeks ago, on Sunday, April 5th, 93-year-old Queen Elizabeth II addressed the British public. Normally, the Queen addresses the public only at Christmas or when a new parliament is installed, making this broadcast especially unusual. It was reportedly filmed in a large room at Windsor Castle by a single cameraman wearing gloves and a mask so as to minimize the risk to the Queen and her 98-year-old husband. In her address, the Queen evoked the very first time she spoke to the British public during the Second World War, when she and her sister spoke to children like my Nana, who had been evacuated from their homes. She spoke of the separation that people then felt from their loved ones and how that's echoed in the isolation we now feel. She promised now, as she did then, that the unity and resoluteness of the British people, and indeed of the global community, meant that soon we would all be reunited with our loved ones, that soon things would return to some semblance of normal. But things aren't normal yet. One of the strangest parts of the COVID pandemic is the way that we are being asked to practice so-called social distancing. And we are being told that by doing so, we can help flatten the curve. Well, maybe I've been living under a rock, but I'd never heard the term flatten the curve until COVID. But let's flatten the curve has become the clarion call for this pandemic. So what does it mean to flatten the curve? Well, during any given illness, a certain number of people will get sick. We talked about this in an earlier episode where I described the concept of R0 and the way that a virus travels through a given population. If you were to make a graph that showed the predicted number of COVID cases as a function of time, you'd find that it looked a little bit like a bell-shaped curve. At the start, there would be very few cases of the illness, but as time went on, there would be an increase. Near the end of the pandemic, the cases would begin to taper off. Once you've got a picture in your mind of what that curved graph would look like, imagine what it would look like if instead of a gradual and slow beginning, many people caught the disease right away. Instead of bulging out somewhere in the middle, the graph would show a big spike right at the very start before sharply dropping off. The good thing about a very sharp and spiky curve would be that we would get the pandemic out of the way quickly. Lots of people would get sick all at once, but then people would stop being sick. Either people would get better or people would die. Of course, we don't want people to die, but the idea of getting past the stage when everyone is ill sounds pretty appealing, doesn't it? If COVID blew through our entire population and petered out, we could go back to eating out at restaurants. We could go to the cinema and get our hair done and work out at the gym. People could go back to their jobs, rescue their small businesses, and travel on airplanes again. At least that's the idea. I guess it would be a bit like pulling off a Band-Aid. You know it's going to hurt, but at least it'll be quick. Now go back to that first picture you imagined, that nicely bell-shaped graph that starts with a few people getting sick, ends with a few people getting sick, and has lots of people getting sick in the middle. Imagine grabbing the tails of your graph, the little right and left ends of the bell, and pulling them away from one another. Notice how the top of the bell isn't quite as high anymore. The graph now slopes gently upward and then back down again. This is what flattening the curve looks like. When the curve is flattened, COVID travels slowly through our population. Flattening the curve doesn't mean that fewer people get sick, but it means that fewer people are sick at any one time. The longer the virus takes to travel through the population, the flatter the curve is. Unfortunately, flattening the curve isn't as easy as grabbing its ends and pulling. If we want to slow down the progress of COVID through our population, we have to limit contact between infected and uninfected people. The trouble with COVID is that you can be infected but not know it, either because you don't have any symptoms yet, or because you'll never have symptoms. So the only way we can keep the infected from the uninfected is to keep everyone separate. This means closing down the public spaces where we gather. It means limiting travel into and out of our country, and maybe even travel within the country. It means working from home. I want to be clear that nothing about this process is easy. Our economy is going to suffer. People will lose jobs and experience financial and food insecurity. Our mental health will suffer from the disruption of our normal activities and through our lack of access to normal coping mechanisms, clinic appointments, and medications. Our children will miss out on continuity in their education. There will be 1,000 other known and unknown consequences. When I ask people to stay home, I do not take the request lightly. And here's the thing. The problem with this graph, this flattened curve, is that it takes a long time to move from the beginning of the pandemic to the end. We aren't ripping the Band-Aid off quickly. We are pulling it off slowly. Depending on who you ask, it may hurt a little more or a little less, but what we can all agree on is that it takes longer. Yes, that does mean that flattening the curve translates into more time off work, more disruption of our social structure, our education, our economy, and our lives. It means a complete rethinking of how we live and function as a society, at least for now. So why prolong the misery? Why not rip off the Band-Aid? The short answer is that our healthcare system is not equipped to handle the curve that is sharp and spiky. Experts recommend that hospitals remain at or below 85% capacity in order to be ready for the surge in patients that can happen during a pandemic. This ensures that there are sufficient resources to accommodate a sudden large increase in the number of patients presenting to the hospital with illness. 85% capacity means that only 85% of beds are full, but capacity isn't just about beds. It's also about having enough staff, enough medication, enough space, and enough equipment to treat all sick patients. In Ontario, our hospitals routinely operate at well over 85% capacity. Many hospitals operate over 90%, with some operating consistently at greater than 100% capacity. When Ontario hospitals operate at greater than 100% capacity, patients are placed in hallways, sunrooms, and rooms boarding more patients than they're designed for. Equipment is in short supply. Nurses take on larger assignments than they should have to, and patients wait longer than they should have to for urgent medicines and procedures. And that's without the added pressure of a pandemic. If our hospitals, already operating way beyond the recommended capacity, are hit suddenly by a surge of sick COVID patients, how will we cope? The frank and difficult answer is that we won't. We won't have enough space. We won't have enough equipment. We won't have enough doctors, nurses, environmental aides, respiratory therapists, and technicians. And at some point, it doesn't matter how many ventilators, beds, or doctors a hospital has, there are just limits to how much any hospital or emergency department can handle at any point in time. We need only to look at Italy to see an example of a healthcare system overwhelmed and over capacity. Flattening the curve means that the pandemic may take longer to make its way through our population. It means that the social disruption we're experiencing may be prolonged in a way that feels almost intolerable. But it also means that we're able to provide healthcare to many more patients because they are spread out over time, never stressing our system to a critical breaking point. It's not just about healthcare, though, and I think we lose sight of that when we talk about flattening the curve. If we can provide better healthcare to more patients, we can ensure that fewer people die. We can ensure that more people return to the workforce and help our economy recover from the devastation of the pandemic. We ensure that the fabric of our social structure ultimately does not unravel. So we don't get to rip off the Band-Aid. Instead, we have to batten down the hatches. Even as social distancing becomes tedious, frustrating, even mind-numbing, we have to keep calm and carry on. We have to believe that our unity, our resoluteness, and our cheerfulness will pull us through this crisis together. Our enemy is invisible this time around, but in some ways it's similar to what Nana and Granddad experienced during the Second World War. Some of us, like Granddad, are on the front lines, dealing with the daily assault and experiencing the realities of constant physical and emotional threat. Others of us, like Nana, are not directly in the line of fire, but experiencing immense social stressors and disruptions to our lives that will affect us forever. I wish I could talk to Nana and Granddad, but since I can't, I can only imagine that this is what they would say. Flattening the curve is not an easy thing, but we must believe that we will be past this soon. We will be together again soon. This cannot last forever. So, where are we now? As of April 23rd, 2020, the date when I'm recording this episode, there are 40,824 cases of COVID-19 in Canada. 2,028 people have died. In Ontario, where I live and work, 12,879 people have been sick with COVID. 713 have died. Many, myself included, have been surprised that COVID hasn't hit our emergency departments and hospitals quite as hard as we expected it to. At least not yet. I think we can say that that's due to the dedication of all those who are staying home, respecting social distancing rules, and working to keep themselves and their loved ones safe. I would like to take a quick moment to remind everyone that COVID is not the only thing happening right now. People are still having heart attacks and strokes. People are still getting appendicitis and bowel obstructions. While we should all be cautious in attending healthcare facilities with non-urgent problems, please seek medical advice and attention if you're experiencing new and worrisome symptoms. Please do not be afraid to see a doctor if you need to. We will do everything we can to keep you safe and make sure that you receive appropriate treatment if you're experiencing a medical emergency. Now, just as much as ever, we are here for you. Before we end this episode, I want to extend a special thanks to Mary and Hugh, the two medical students who are the brains behind this operation and without whom this series wouldn't be possible. Thank you also to the brave folks who keep our emergency department clean, stocked with fresh linens, and running well. Thank you to the parents who are educating their kids at home. Thank you to the drivers who are delivering food. Thank you to the family physicians and specialists who are seeing their patients in flexible and innovative ways using new technology. Thank you to everyone who's staying home. I'll be back with another episode soon. Until then, wash your hands, don't touch your face, and please, stay safe.